We have to abide by the instructions. It's very important because we are really on the threshold of exiting the pandemic. I want to present a plan of 5 steps to surely step out of the pandemic. But this is not something that perhaps is going to happen. It's happening actually now. But before that, I want to show you the situation of today. Please, let's see the slide. This is the number of people who are inoculated and recovering in Israel. When I say inoculated at least once, that gives quite a lot of protection. And of course, among them, there are more than 3 million people who were inoculated twice. So the number we want to reach is 6,200,000 people above the age of 16 in Israel. And we're still quite far away even from one dose of 1,200,000 people. Can I see the morbidity, please? This is what's happening with morbidity in Israel. Here you see a little hill. We had a closed lockdown and we went up. Again, this is the second lockdown. We went down. We went even higher. Then there was a third lockdown and we're still with a few thousands of verified cases, positive cases. So there's a gap that exists between the number of people who already were inoculated and those who still haven't. We must bridge this gap in order to reopen our country. And I want to ask you, why do we have this gap? There are a few factors, but first and foremost, the main reason that we have this gap is because of fake news. People say the vaccine is not natural, it's exaggerated, there are all sorts of side effects, it's not secure. This was said about all the former vaccines in the last 150 years. They said it about chickenpox and measles. And I want to underscore something. The virus is what's attacking us. The virus is the thing that's not natural. And the inoculation is a protection. It's a wonderful gift for humanity. Before the era of inoculations, the longevity, on average, was about 30 to 40 years. And the vaccinations, more than anything else, doubled our longevity, our life expectancy. So I tell you, don't believe fake news. Go get the vaccines because they protect and they save life. They prolong life. We saw the terrible tragedy of Osnat, a very young, beautiful woman. She had a real captive smile. She was pregnant and she died of the coronavirus before she managed to get the vaccinations. She left 4 orphans and even her unborn baby died. She had a relative who was a leader of the protest groups against vaccines, and he told her, don't get the vaccine. Today, her family is leading groups in order to convince the people in Israel to go and get inoculated. But still, as I said, we still have this gap of more than 1 million adults in Israel who haven't even received the first dose. And that means that many of the citizens in Israel still may contract a very serious disease and even die. All over the world, the citizens are waiting for vaccines. In Israel, the vaccines are waiting for the citizens. We have to change that immediately. In New York, Miami, Los Angeles, in Europe, you cannot obtain vaccines. Talk to your relatives, to your friends. They are pleading to get vaccinated. You know, adults in other countries are waiting for months, long months, in order to get inoculated. They're asking us to give them, to bring them vaccines. Here, the vaccines are waiting for you, and we can exit together from the coronavirus with security and assuredness. Of course, I congratulate the millions of Israel who already were inoculated, and the medical staff and the Israel Red Magen David. With their help and the help of God, we're going to exit this pandemic. So these are the 5 stages of exiting from the pandemic. The first stage, the first one is 0. It's now. It's the holiday of Purim. I'm not showing it, but you will hear the Minister of Health and everything we have to do in order to ensure to cross this holiday with safety. So now we're talking about 81% of the citizens of Israel who are inoculated at least once, and this is the green passport. That's stage 1. Stage 2, the second week in March, is opening the education system gradually. The third stage is green passport stage 2, also in March. The fourth stage, at the end of March, we want to finish inoculating all the adults in Israel, 16 and above. And in April, we plan to reopen completely. Of course, this depends on the level of morbidity, but if we all do what we have to do, then we're going to cross it with the response of the citizens of Israel, the closed borders, including the airport, in order not to have new mutations come in. We want our population, if it's possible, will be completely inoculated. It gives us protection also from the mutations and the variants we know today, but of course there may be new ones. And with your help and the help of God, we will pass this together so that we can get to the Passover holiday together. And in the Passover holiday, we'll ask again, what is this night different from all the other nights? And this time we shall answer that this night we are all inoculated. And therefore, I would like to ask all of you to follow the instructions, and I would ask the ministers of health and the home front why it's so important to abide by the rules and to talk about the next stages of the exit. Let us have a very joyful, happy holiday of Purim, still with the masks. The health minister, thank you, Prime Minister, the commander of police, the heads of the HMOs. Purim, the holiday, is just ahead. This is a holiday of masks. We all like the costumes, to be happy. This year, this mask is more important than any other mask, even if it's not as beautiful. Purim is ahead of us. This is a holiday of children. It's a great holiday for children. Friends, the children are still not inoculated. It's not their fault. No, there's no permission to inoculate them. Let's guard them. Let's stop all the parades and all the parties that unfortunately we do hear about. And it's not just underground, things that are organized by authorities, by municipalities. They want the kids to be happy, but the result can be really exactly the opposite. Purim is ahead of us, and it cannot be that this year it will remind us at all of Purim of last year. That collective memory that we have from last year, it's still alive and kicking. What happened in Purim of last year during the holiday, and what results we got following all these festivities. But there's also a great difference that I can talk about between Purim last year and the one ahead of us. The difference, first of all, the vaccines. Yes, it's true. The Prime Minister just spoke about the gaps that still exist. But a large number of people came, got the vaccines, and it's good, and the people from the HMOs and the Israeli Magen David are saying that we hope that in another few weeks the numbers are going to be different. The second difference, as I said, we already have experience, and we know what instructions to give. We know that it's possible in a very organized, concise way to celebrate the holiday and to do whatever has to do, but not to crowd, to avoid any contacts, and to guard ourselves and protect the country and protect our health. There are objectives, very nice ones. There's a roadmap. How do we get to these objectives? The two tracks are quite obvious. Inoculations and then abiding by the instructions. If we will go according to this map, we will come securely, we won't have any more lockdowns, and we can lead our country beyond to this disaster of the coronavirus. The cooperation of all of us is very important. Even the best doctors cannot do it alone. The government can't do it alone. More experts cannot do it without the collaboration of the entire public, of each and every one of you. Let us all have a very happy Purim, but very cautious and very healthy. Thank you. Good evening, ladies and gentlemen, Prime Minister, Minister of Health, the heads of the health system, Commander of Police. Happy Purim holiday. We are beginning to exit this dark tunnel we were in the last year of the coronavirus, and we already see the light at the end of the tunnel. Until recently, we had a very tight close down, and we are exiting gradually. Why gradually? Because among us we have many people who were not inoculated yet, despite the fact that Israel is the only country in the world that has today the capability to inoculate any citizens who wants it. In other countries, people are pleading for vaccines that don't exist there. And these citizens who did not come to the vaccines are still at risk, at a high risk. Last week, we had to say farewell to a policeman, 44 years old, healthy, no former illnesses, who contracted coronavirus and died. He decided not to take the vaccines, although Israel was one of the first countries that enabled the police force to be inoculated, and he's not with us because of this risk that is very significant. The government made a few decisions that you all know regarding the Purim holiday. We said a night curfew, no parades, no parties, all these events that include masses of people. Naturally, in such events, people also drink alcoholic drinks, and that raises the fear of not really abiding by the instructions to protect from corona, things that save life. Yes, we say to masks and to distances, but not to crowds. The police does not want to confront the citizens. All the police are going to be enlisted in order to fight terror and crime and not a pandemic. But at the end of this week, the police is going to be deployed all over, all through the country, in the cities, outside of the cities, in order to enforce the law and to deal with people who are going to jeopardize the health of the public. Unfortunately, I have no doubt that there will be violations. Well, you cannot murder, but people still commit murder. But even if the police will not come and see all the violations, they'll come to most of them. Nevertheless, I want to call upon anybody who's listening to us now to abide to the instructions, not because of the police or the law, but because we want everybody who is with us in this Purim holiday will be with us in the next holiday next year as well. And next year, we want people to have masks of all colors, of all forms, not like these. And it's possible. Please follow the instructions. They save life. Yes, there's a price in order to follow the instructions and not to do exactly what you want to do, what you regularly do. But this is a very small price to pay for the reward, and the reward is saving lives. our lives, the lives of our people around us, our beloved people. Human behavior is what brings about the virus. The chief of police will tell us more about the way they're preparing, and I want to thank him and to the thousands of policemen and women who work tirelessly in order to protect the security and also the health of the people in Israel. I also want to thank the people, the citizens, most of whom are very responsible. A healthy and happy Purim holiday to all. Good evening, everybody. Happy Purim. The police will prepare itself at the end of the week for a large deployment. We are going to enlist all the resources we have in order to enforce the instructions and to maintain the health. This way, we're going to have roadblocks deployed all over the country, between the cities, within the cities. We're talking about 250 roadblocks. More than 500 police cars are going to travel all over Israel, and other forces who will be deployed in order to enforce all the instructions. There will be designated forces that will work in places where they will have severe violations. All the intelligence of the police is operated, and we know that there are a lot of planned mass parties and mass gatherings. And we want to thwart those events and to foil them. I instructed the investigation division to open charges, to press charges, not only fines, but press charges in all these illegal gatherings. And I want to underscore that the point of the Israeli police, its designation, is to deal with daily other things, not in coronavirus. We call upon the public and we ask them to please be responsible. All of us, we are all in the same situation, and we expect from the public to abide by the rules because they can save life. Thank you. Good evening, everybody. I want to say that the virus is still here. We haven't eradicated it yet. So therefore, we are toiling in order to prevent and to inoculate. We already inoculated 4.5 million people in the first dose, out of whom some 3,200,000 with the second dose. This is unprecedented. We're still, together with the help of the Prime Minister and the Minister of Health, to bring more vaccines in order to inoculate those left, those 2.6 million that without the children, of course, and people who recovered from the disease. We saw that the disease hits young people, and unfortunately even a woman who was pregnant and wasn't inoculated. So therefore I call upon everybody, come, get vaccinated. We already 86% of the 50 and above at the risk group, we already inoculated. And again, I want to call upon everybody to come, get vaccinated according to our request. Don't respond to fake news, and this way we will be able to protect ourselves from the disease. I want to thank all the health system in the community and also in the hospitals, in the wards, for their dedicated and professional work that they do in dealing with the patients, and to thank the directors of the HMOs and the Israeli Red Magen David giving the vaccinations. A healthy, happy holiday, and of course continue to get vaccinated. The Corona Czar, please now, Professor Ash. Hello, everybody. Good evening. We are at a very delusive period. On the one hand, we have the vaccines, and we do inoculate in a wonderful pace. But at the same time, we also have the decline in the morbidity. And you saw the slide. It's quite significant. But still, we have some 3,500 positive cases every day. It's a very high number. We still have some 800 severely ill people in the hospitals. It's a high number, and we are coping with a British variant which has spread very quickly in the state of Israel and causes a lot of morbidity, maybe even more severe. In view of all that, we are committed to continue to be very careful with what we do. The final party cannot begin now. We still have to work hard in the vaccines and also of following the instructions. And in view of that, we decided on these steps for the holiday of Purim. It is a happy holiday, usually, and we were really thinking what kind of steps we can take, and we decided to do this night curfew in order to pass this hurdle of Purim holiday without too many infections. And I call upon the public to be responsible. The curfew itself, it's not a magic thing. But during the day as well, according to the limitations and of the gatherings, and of course in the evening, at night, without parties, without any festivities, you can be happy, but much more modest this year. Always remember, as the PM said, remember what happened last year, so that we don't get to a situation of morbidity that we suffered from last Passover. Thank you. Thank you, the head of the public health, Dr. Sharona. Happy holiday. We are now with a wave of mobility which is decreasing little by little, and that derives because of the British variant. It's 90% of the samples that we are now sequencing all over the country. There's also entry of other variants, South African, which is 1% of the samples, and this shows how easy we can find ourselves in a place we wouldn't want to be in, with all sorts of variants that are more dangerous. They all start spreading, and now we know that these two variants, the vaccine is efficient, so I call everybody to go and get vaccinated. We saw in our data of the state of Israel that the efficacy of the vaccine a week after the second dose is 95% of preventing morbidity with symptoms and also of severe morbidity and mortality. And had we waited another week, we see that it's even 99% efficacy. So if we look at 100 people who were not vaccinated, and if they become severe ill, had they been inoculated twice, then 99% of them would not get to the hospital. So you have to understand, it's not hermetic. It's not a ceramic cover that you can just walk around without masks and everything. You still have to, even people who have a certificate, have to continue to be careful. But 99 people out of the 100 would have been saved. That's why it's important. We see it also in the hospitals. Those who arrive in the hospital are people who were not vaccinated, and also morbidity of young people who haven't been inoculated. So I really recommend to anybody who can, over 16, go and get vaccinated. The last thing, I too would like to thank the HMOs doing a wonderful work, the hospitals, the Magen David Adom, and also the staff of the Ministry of Health. They are working tirelessly against this pandemic in order to investigate and to understand exactly how we get infected and to try to prevent as much as possible. So thank you, everybody. Happy holiday. Take care, and go get vaccinated. Thank you, Director General of the Klalit HMO, Professor Davidson. First of all, I'd like to join giving thanks and appreciation to the staff in the hospitals, in the community, who are working really around the clock in order to save people. Not just the virus, there are other diseases as well. We're in the midst of a huge step, unprecedented in the state, to vaccinate millions of citizens and actually to save their lives. But still, there are hundreds of thousands of people, older, younger, who decided not to get vaccinated. And I think that they are actually jeopardizing their own lives and their families. As it was said, the vaccines are very efficient, and it's the right thing to do. On the other hand, the young people also contract the coronavirus. Some of them died just because they didn't go to get vaccinated. Vaccines are available. The system is ready. Just come and get it and save your life.